Okay, before we start, I want to ask a quick question. How many of you feel completely confident that you understand all the parts of Medicare? Anyone? Oh, wow, not even a few hands. Usually I have a few of them. Well, don't worry, you're not alone. That's why you're here. Medicare can be confusing, right? Can be confusing. And that's why you're here tonight, to learn more about Medicare. Good evening. I appreciate you guys all coming to spend the evening with me. My name is Enza Haas, and I'm with Kenneth Young Center. I've been working with older adults and people with Medicare, trying to have them understand their different healthcare choices and their options that they have when they are transitioning to Medicare. So I'm going to jump right into it, and I just want to thank you guys again for coming tonight. So welcome to Medicare. This is what it looks like, right? A big maze. What do I do? What do I sign up for? I want to make the best choices. I don't want to overpay. Topics we'll cover today is what is SHIP, Senior Health Insurance Program, the basic parts of Medicare, who is eligible for Medicare, important Medicare enrollment timelines, the different ways to receive Medicare coverage, what it's going to cost you, your Medicare cost, and Medicare supplement, also known as Medigap plans. What is SHIP, Senior Health Insurance Program? It was established in 1988. It is a federal program. It's a free Medicare counseling program. It's sponsored by the Illinois Department on Aging. SHIP does not sell or recommend. We are not insurance agents. We are here just to provide you and educate you about Medicare and about your coverage options. I train volunteers. I'm always looking for volunteers. If anyone is interested when they retire, they want to give back a little bit, they want to educate people on Medicare, I'm always open to new volunteers just in case anyone's ever interested. I offer one-on-one counseling to Medicare beneficiaries, family members, and caregivers. And I also assist with enrollments, meaning only prescription drug plans and other benefits that Medicare beneficiaries may qualify for. This is the Medicare card. Your card has a Medicare number that's unique to you. On the Medicare card, it says Part A, which is known as hospital coverage, and Part B, which is medical, and the date your coverage begins. Coverage dates may be different. It depends on your current situation. Each date could be different. Not everyone takes Medicare Part A at the same time, or B. 4 basic parts of Medicare. There's the Part A, the hospital insurance. You got your Part B, the medical insurance. You got your Part C, you've seen a lot of those commercials, the Medicare Advantage plans. And your Part D, which is your prescription drug coverage. Eligibility for Medicare. Who's eligible? You have to be 65 or older. People who are getting disability have to be deemed disabled by Social Security for 24 months. People diagnosed with end-stage renal disease, Lou Gehrig's disease, known as ALS. You have to be a U.S. citizen or a legal resident who has lived here for 5 continuous years. Who handles Medicare enrollment? Medicare does not. Social Security Administration handles enrollment for Medicare Part A and B. You can enroll online at ssa.gov, meaning you have to create an account. You could call them up, say I want to enroll in Medicare, or in person at your local Social Security office. Important, after enrolling in Part A and B, you can choose additional coverage such as your Part D, a Medicare Advantage plan known as Part C, or a Medicare supplement, also known as the Medigap. So this is important. Medicare gives you 2 options as far as coverages. You have your original Medicare, and they give you, or Medicare Advantage plan, which we will discuss further. These are your 2 options that you have. Medicare timelines, extremely important. Enrollment and plan changes are limited to specific times. You cannot enroll in Medicare anytime you want. If you decide you retire, but you don't want to enroll right when you retire, you can't decide, well, you know what, I'm going to enroll like 5 months later or 2 years from now. It's important to understand when you can enroll or make changes. Medicare has several types of enrollment periods depending on your situation. The initial enrollment period. This is a 7-month period window where Medicare beneficiaries can enroll in Medicare, also known as the 313 rule. 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. This is when individuals, when they're new to Medicare, are going to utilize this enrollment period. 313. You have your general enrollment period. You miss your initial enrollment period. You have to wait till January 1st. January 1st begins, and then you have till January 1st and March 31st of every year. That's if you do not enroll in Medicare Part A or B. Penalties for late enrollment usually apply and a delay in coverage occurs. So remember the penalties. You have your special enrollment period, designed and designated circumstances that allow Medicare beneficiaries to enroll, drop, or change coverage outside of a normal enrollment period. Examples, you left your active employer group health insurance. I see this a lot today. People are working beyond 65. I think retirement age is 66 and 7-8 months, around there. 10 months, it went up, 10 months.
I am 59.
Oh, there, you're young, you're a youngster. You shouldn't even be here. Huh? You have a Medicare Advantage plan, and you moved out of your service area. And if you have some low income programs, which is extra help, or you gained or you lost your Medicaid coverage. So again, the special enrollment period, I see that a lot today. All right, basic Medicare A cost. Nothing is free, right? Part A, as discussed, is hospital insurance. Your premium is $0 if you or your spouse have at least 40 quarters through your employment. 99% of beneficiaries usually do. I don't see this often. If you have less than those 40 quarters, 30 to 39, it's $311 just for Part A, and less than 30 is $565. Part A deductible is $1,736 for 2026. It tends to go up every year. Your coinsurance, if you're in the hospital, is day 1 through day 6. You pay $0 after you pay your Part A deductible, that's $1,736. If you're in the hospital beyond 60 days, you pay $434. And you have up to a lifetime of reserved days, up to 60 days, and that's $868. Rehab, skilled nursing facilities, days 1 through day 20, you pay nothing. 21 to 100 days, you pay $217. Now these prices are without a Medicare supplement Medigap. This is what you would have to pay. Medicare Part A benefit period. I get this question a lot of phone calls. What is this deductible period? What is this benefit period? It's Medicare hospital coverage is based on a a benefit period, not a calendar year. Meaning, a benefit period begins the day you are admitted to a hospital as inpatient. It ends after you have been out of the hospital or skilled nursing facility for 60 consecutive days. If you are admitted after those 60 days, a new benefit period begins. Okay? So you're going to have to pay that deductible again. For an example, David is hospitalized for 5 days and then he goes home. He returns to the hospital within those 60 days, it is the same benefit period. If he returns after those 60 days, then a new benefit period starts and a new deductible is charged. Any questions? Because I get a lot of calls regarding this.
So a deductible is not based on a year, it's based on?
60 days. Yep, 60 days. A benefit period, not a calendar year. That's just for hospital. That's why I always put a slide in this. Especially as we get older, we don't know what's going to happen, right? All right, Medicare Part A hospital coverage. What does it cover? It covers inpatient hospital care. You get your semi-private room. You get some room service. You get some meals, nursing care, your drugs that are part of your inpatient treatment plan, your hospital supplies and services. After that, sometimes you may have to go to a skilled nursing facility. You get your semi-private room, your room service, your rehab, your physical occupational speech therapy, medications, supplies, ambulance transportation if it's required, and it covers hospice care at 100%. That's the one thing Medicare will cover. Your basic Medicare Part B cost. Remember Part B? Does anyone know what that covers? Medical. Good. It went up this year. It was from $185 to $202.90 this year, sorry. Not sure if you heard of the IRMA. It's for higher income individuals may pay more. If your income is higher, you're going to pay more. The annual deductible for Part B is $283 a year. And cost sharing without a supplemental coverage, after your deductible is met, that $283, Medicare pays the 80% and you're responsible for the 20%. No annual out-of-pocket limit with original Medicare alone. Just have to be responsible for that $283 and then that deductible for Part A, that's $1,736. We're good? The IRMA, there it is, the income-related monthly adjustment amount. This higher income Medicare beneficiaries may pay higher Part B and Part D premiums. Your Social Security determines your IRMA based on your federal income tax return from 2 years ago. They'll go back 2 years. Where to find more information is Medicare.gov or SSA.gov or your Medicare and You handbook. If your income has decreased due to a life-changing event, you retired, you're no longer working, you get divorced, you can request a reconsideration with Social Security.
Also, the government won't check your gross earnings every 2 years?
They can, yeah. You have to be up front.
Just to see? Yeah.
Just to see. Or you're going to have to pay them back. They find out everything. So. Medicare Part B, what does it cover? Your medical expenses, going to your doctor, your blood work, your outpatient physical therapy, occupational, diabetic testing supplies, your home health care covers outpatient hospital services, DME, your durable medical equipment, anything medically necessary that you're going to need when you get discharged, your wheelchair, your walkers, your hospital beds. Once you have had your $283 expenses covered, Part B deductible is met for the whole entire year. So remember, you have to meet that deductible first in order for Medicare to pay. Part B. Medicare supplements, also known as Medigap. It's a standardized insurance policy sold by private insurance companies. It's designed to help fill in the gap, right? Medicare covers 80, the Medigap fills in the 20%. It works along with Medicare Part A and B. If Medicare is not going to cover the service, your Medigap is not going to pay the 20%. Medicare is always the primary payee. All Medigap plans include certain core benefits that help reduce out-of-pocket costs. There is 12 standardized plans on the market today. As you can see, it varies by coverage. Remember, Medicare is always the primary payee. Plan F used to be known as the Cadillac plan prior to 2020. That is no longer, you're no longer eligible for those programs unless you became eligible for Medicare prior to 2020. So Plan F covers everything at 100%. Most popular Medigap plans today, people come see me like this, tell me what, this is a big chart. I know there's a lot of plans, but I want the best coverage. I don't want no surprise bills. Just tell me what is the best. Plan G covers almost all Medicare costs. The only thing not covered with Plan G is the Part B deductible, which is $285 a year. Includes the Part A deductible, so that Part A deductible is covered. Remember, that's $1,736. So you can go to the hospital every 60 days, it's gonna get covered, right? You don't have to worry about it. Your skilled nursing co-insurance, those co-pays when you're in the rehab center or the skilled nursing. Foreign travel, if we have any foreign travelers. Hey, I'm gonna travel to Europe now that I'm retired. It covers 80%. And your Part B excess charges. It's best for people who want predictable costs. I just wanna know what it's gonna cost me per month. I want no surprises. You have your Plan N. It's a lower premium option, not by much. Similar to Plan G, except you have small doctor visit copays. Maybe an ER copay, $50 if you go to the ER. Does not cover Part B excess charge. Part B excess charge can be up to 15% above the Medicare approved amount. You go to your doctor, he doesn't take Medicare assignment, right? The bill's $100, he's gonna charge you $15. But 99% of doctors take Medicare. Doctors today just wanna get paid, right? I don't even think there's really a lot of individual doctors anymore. It's all group related. Yeah, right. Best for people who want lower premiums and don't visit doctors frequently. They don't mind going with the Plan N. I go to the doctor once a year. I go for my blood work, my annual physical. I don't mind paying that $20.
And has no foreign travel.
And good question. It does have foreign travel. It does, yep. I gotta add that in there. Have my assistant add it. But it does, very comparable. Part D. What is Medicare Part D? So Medicare Part D helps cover your prescription medications. There's two types. You have your standalone prescription drug plan. It works with original Medicare and it covers your prescription drugs only. It doesn't cover anything else. You have your Medicare Advantage plan with drug coverage. Combines medical and prescription coverage and replaces your original Medicare coverage through a private plan, private insurance company. Important notes, plans are offered by private insurance companies. Each plan has its own drug formulary. So right now there's 20 Part D plans on the market. They're gonna cover at all different costs. Cost and covered medications vary per plan.
Someone told me that if you don't take the prescription plan,
Oh, that's the next slide. You're good. She did her homework. I'm gonna have her come do the presentation. Part D enrollment periods, very similar. We already pretty much went over this. Your initial enrollment period, remember that 313 when you're new to Medicare? 3 months prior, month of your 3 months after. You got your annual open enrollment. I advise everyone to take advantage of the annual open enrollment. It's from October 15th through December 7th. It gives you an opportunity to change your plans, to look over your plans, make sure that you're paying the lowest cost for your medication co-pays. I had a client this past year was paying $130 a month for a Part D plan, and he was taking one medication. Because he just figured, when I turned 65, I signed up for the plan, and I never looked into it again. So it takes 5 minutes.
So do you do that every year now?
I do it every year. It's one of my busiest times a year. But I can train you how to do it. Don't worry. I have people that come in my office and just tell me how to do it. And drug coverage. You know, just making sure, like I said, just want to make sure everything is, you're paying the lowest cost, you're good. You got your enrollment period, your special enrollment period. You know, if you're, say you're with a Medicare Advantage plan, if you're moving out of state, you would have a special enrollment period to look into another drug plan or Medicare Advantage plan. Or you're losing your credible drug coverage through your employer. Your employer is dropping you from their insurance, or you're retiring. That's another special enrollment period. So like, I put these out here a lot because these dates are so important. I don't want you guys getting penalized for anything. We already pay enough. There's 3 phases to your Part D plan. Phase 1 is a deductible. You pay 100% of your prescription cost. The maximum deductible this year is $615. Some plans may have a lower deductible. Once your deductible is met, you'll move into phase 2. You pay 25%, your drug plan pays the 75%. It continues until you reach the annual out-of-pocket cap of $2,100. After that $2,100, you phase out. Once you reach the annual out-of-pocket maximum, you pay $0 for the rest of the year for your medications. So, yes,
2,100 inclusive of the 615 or is that?
that's included with the deductible. Good question. Yep, that 615 is included with that 2,100. Key points. If a drug is $0, the plan waives the deductible for that tier. It does not count toward that deductible. Deductible is only reduced when the member actually pays out of pocket, when you're at that pharmacy and you're paying a copay. Example, plan deductible is $615. You're taking the tier 1, you're taking lisinopril. I'm not sure if that's for blood pressure or cholesterol. Your deductible is waived because it's a tier 1 and you pay $0. The deductible remaining is $615 because you didn't pay anything. You didn't have to pay a copay with that tier 1 drug. But later in the month, you have to fill a tier 3 drug. That copay, your deductible would then apply because that copay will be applied to that $615. Important distinction, count toward deductible. Members paid during deductible phase does not count toward deductible. 0-tier drugs or preventative drugs. So I always try to, tell my clients, try to go on generics. Anything below tier 3, you usually don't have a copay, very minimal, or 0. Once you get beyond that tier 3, tier 4, tier 5, that's when it's going to start becoming expensive across all plans. Medicare Part D late enrollment penalty. I have a lot of clients that come see me, I'm new to Medicare, I'm healthy, I don't need a drug plan. I don't take medications yet. My parents live to be 95, right? Medicare recommends enrolling when first eligible to avoid future penalties. If you go 63 days or more without credible prescription drug coverage, you may have to pay a Part D enrollment penalty. The penalty is 1% of the national base beneficiary premium for each month you did not have coverage. That penalty is added to your Part D premium. It is a penalty that will never go away. It's permanent. So what I advise is let's get you on a drug plan, even if you're not taking medications. There's a couple of plans out there. One is WellCare. There's Humana. It's 0 premium. So that's what I've been doing for those clients, just to make sure, because you never know what's going to happen, right? Right now, we're healthy, but we don't know what tomorrow's going to bring.
So can you switch between, say you start out, you're not taking it.
Yeah.
So you start with, say,
Mhm.
and then something happens, you're in your 70s,
Yeah.
you've taken a lot of drugs.
Yep.
If I then suddenly want to switch,
Yeah.
whatever, can you just switch back and forth, or do they say?
No. So you have to, like I recommend, you always want to go back to that open enrollment period. So every year, you should review your Part D plan. And you can switch during October 15th through December 7th. And you'll see a lot of commercials. You'll see it online, right? We've watched late night TV, Family Feud. It's always those commercials, right? They're always on. So don't worry, they're going to remind you. You're going to be getting a lot of extra flyers. So, or you can call me. I could do it for you really quick. But it is permanent. It will stay with you as long as you have Part D coverage. How do I find the plan that's best for me? You go to Medicare.gov, you create an account, click on Find Health and Drug Plans, you enter your medications, and then you'll get a list of all the companies that will cover your medications. And again, prices will vary, formularies will vary. But if you're not comfortable, I'm always happy to assist with that.
Once you start an account, it's locked in.
You know,
You have to re-enter the
you have to remember your user ID and your password, but a lot of clients don't because they only go into it one time a year, right? But you can always unlock it and renew your password and stuff like that.
Write it down on the passwords.
You really should, yeah. I always tell clients, keep this in a safe spot. Part C, Medicare Advantage plans. What is it? It's a Medicare Advantage plan is an alternative way to receive your Medicare benefits through a private insurance company approved by Medicare. What does your plan include with Part C? Your Part A, your Part B coverage. A lot of them cover your Part D prescription drugs. A lot of them cover additional benefits, right? These are what these commercials are promoting. Your dental, it covers vision, silver sneakers, fitness programs, transportation. I think now one company is offering a $1,500 a year food card. Got a call on that. Important things to know with Medicare Advantage is plans may have provider networks. So you have your HMO and your PPO. Members may need referrals for specialists. And plans have an annual out-of-pocket maximum. So each plan does have a big deductible that you have to meet.
Part C, is that for the drugs also?
Yeah, a lot of them usually include a Part D plan. The Part C. Premiums, you're going to have to pay for that Part B premium. In order to enroll in a Part C, you have to have Medicare Part A and B. So you have that $202.90, usually comes out of your Social Security check. If you're not collecting Social Security, you're billed every quarter for that. Many plans offer 0 monthly premiums, meaning that you just pay that $202.90, and there's no additional premiums to enroll in that Part C plan. Simple explanation, Medicare Advantage plans bundle hospital, medical, and usually drug coverage into one plan offered by private insurance company. There's those enrollment periods. You got your annual enrollment period. October 15th through December 7th is when you can make changes every year. You can join a Medicare Advantage plan during that time. Switch Medicare Advantage plans. If you're not happy with your current plan, you can switch to another one. Leave your Medicare Advantage and return back to original Medicare because you don't want a Medicare Advantage plan. You want to go with a Medicare supplement now. You could join or switch or drop a Part D plan. You review your drug plan, make sure that they're still covering all your meds at a low cost. Any changes you make during that open enrollment, October 15th through December 7th, coverage begins January 1st. Am I in your way? I'm sorry. Medicare Advantage open enrollment. If you decide that you don't want to make any changes during open enrollment, Medicare Advantage also has another enrollment period, January 1st through March 31st. This is for Medicare Advantage plan only. If you are already enrolled in a Medicare Advantage plan, you can switch to another Medicare Advantage plan or leave the Medicare Advantage plan and go back to the original Medicare. Can also add a Part D if you return to original Medicare during the Medicare Advantage open enrollment. Any questions? I don't. You mean that? I'm sorry.
Back then they do medical rating on you. Means that
Underwriting. Underwriting.
It's not guaranteed like Obamacare.
Right.
It's important to know.
It is very important to know. So what this gentleman is saying that, say you want to switch back and forth and you want to go back to original Medicare, they could underwrite you. Any private insurance company could start underwriting you, asking what your pre-existing conditions are. So they can deny you coverage for a Medicare supplement plan. So that's why when you were screening you during your initial Medicare enrollment period, it's really important to think about longevity and your genetics and just overall look at yourself. Are you one that's going to eat healthy? Do you have diabetes? Do you have high blood pressure? Do you have pulmonary disease? These are things that you really have to think about when you are deciding what route you want to go as far as coverage for you. Because during that 313, that initial enrollment period, they have to guarantee you insurance. They have to give it to you. Right now in the state of Illinois, Blue Cross is guaranteed that they will give you insurance, even if you don't do it during your initial enrollment period, but your premiums are a lot higher. Their premiums are higher. Yeah. Thank you. Only one change is allowed during this period. So you can't be going back and forth every month. I changed my mind, I want to do this now. No. Part C, pros and cons. You got your pros. You got low to zero monthly premium options. Your Part D drug coverage is included. May include those extra benefits. You got your dental, your vision, your hearing, your silver sneakers, your annual out-of-pocket maximum for protection. Sometimes it's $3,500. Once you reach that $3,500, you're done. You don't have to pay anything else. Some of the cons, you still have to pay that Part B premium, that $202.90. Provider networks, you have to stay within the network. Referrals may be required for specialists, and coverage may be limited when traveling. So if you are a foreigner, you like to travel, this may not be the best plan for you because they'll cover an emergency, but anything beyond that, you're going to want to stay close to home. Medicare Advantage plans may have lower premiums and extra benefits, but they often have provider networks and more plan roles. You have to read between the lines. Nothing is free today. Nothing is free. Sometimes my clients will call me, can you go over this Medicare Advantage plan with me? And I'm like, come on over. Let's review it. I don't want no hidden costs. I want you to know what to expect. Also, just the difference between if you go with an HMO Medicare Advantage, you have to stay within that network. If you go with a PPO, you are able to go outside of the network, but you will have a higher co-insurance. So you will have to pay something out of pocket. Stressed about Medicare yet? Yeah, don't be stressed. All right, I got a couple scenarios. You got Carol. She lives in Colorado, and she's going to be 65 in 3 months. She plans to retire at that time and spend a lot of time traveling to California to visit her children and grandchildren. Carol's in good health. She takes 2 prescription medications, one to maintain bone health and one to manage her cholesterol. This is actually one of my clients. She receives a comfortable pension but is mindful of her finances and wants to control her healthcare costs while preserving her savings. What does Carol want? She wants access to doctors nationwide because she's traveling a lot to visit her daughter and her grandchildren. She does want help paying for her prescriptions, and she wants protection from high medical costs. She doesn't want any surprises. What we decided, because it's always your choice, to go with original Medicare Part A and B. We signed her up for the Medigap, the Plan G, which covers everything at 100% except that Part B deductible. And we got her a Part D plan, a standalone Part D. Key features is nationwide provider access. If something happens to her, she can go anywhere she wants. She doesn't have to worry about finding a doctor. Most out-of-pocket costs are covered. Once that Part D deductible is paid for, she has no other costs. And her lower prescription drugs, she takes very minimal, always all tier 1. So what are her premium costs for the month? We got her Part B, $202.90. Her monthly Part D plan was $22, and her Plan G was $170. Comes out to $394.90. She does have copays, $10 copays for each. She fills them monthly. So with her monthly premiums and prescription copays, you're looking at $415 a month. Yep. Other possible costs is the original Medicare with a supplemental plan covers most out-of-pocket medical costs. It pretty much covers everything. Prescription drugs are not covered by the Medigap plan. Just remember, no prescription drugs are covered by that. Additional drug costs will depend on the cost-sharing rules of her drug plan. We don't know what to expect of Carol. Hopefully, she is still really healthy, only takes 2 meds. But let's like to give you guys an idea what it's going to cost if you go this route. So you're looking at about $400 a month. You got your Medicare Advantage. You got Dave. He recently turned 65 and plans to retire from work. He's done working. He does not intend to continue working past age 65 and does not have retiree health coverage through his employer. David plans to enroll in Medicare during his initial enrollment period. Anyone remember what that is? 313 rule. David is in good overall health and takes good care of himself. He currently takes 1 prescription medication for his blood pressure. He's pretty mindful of his finances and works hard really to live within his budget. What Dave wants, he says, I want preventative care covered, I want financial protection, access to specialists, prescription drug coverage. He didn't even have a primary care doctor when he came in to see me. So he was pretty open, flexible. What we decided with Dave is we were going to go with the Medicare Advantage plan with prescription drug coverage. That plan covered preventative services. He got his silver sneakers. He said he was going to start working out. His drug coverage included. He was fine with the network of doctors and hospitals. Like I said, he didn't even have a primary care physician when he came in to see me. And the maximum out-of-pocket that he would, if something catastrophic were to happen, it would be $3,500 for the year. He was fine with that. What are Dave's costs? Monthly Part B, remember you can't have a Medicare Advantage without Medicare Part A and B, which is $202.90, that Part B. The Medicare Advantage had no additional premium. It was free. So his total monthly was $202.90. All he had to pay for was the $202.90, the Part B. David's Medicare Advantage plan plus his blood pressure medication with his $10 copay brings his estimated monthly Medicare cost to $212.90 versus $414.90. Other possible costs, remember he's going to have copays when he goes to his doctors, co-insurance, deductibles. He does have that $3,500 out of pocket. Cost will depend on the services he uses, the prescriptions filled, and whether care is in-network or out-of-network. With Dave, we went with PPO, where he has the option if he wants to see someone out of the network. Yes,
Does an Advantage plan always have a high deductible?
for the most part, yeah. Yeah.
Like a couple few $1,000?
That's pretty minimal. They usually go up to like 7,000.
7?
Yep. His plan has that annual out-of-pocket maximum. Once Dave reaches that limit, the 3,500, the plan covers 100% of covered services for the rest of the year. So something catastrophic has to happen, right? He has to either be hospitalized or going to the doctors a lot. But something to think about with the Medicare Advantage is every time you go to the doctor, you got to pay a copay. A primary care doctor is $25. You see a specialist is $40. If you have to go for physical therapy 2 times a week, that's $40 every time you go see that physical therapist because it's known as a specialist. So things to think, you got to think about this.
So nothing would get covered until that 3,500 was met?
Oh, no, you would have small co-pays and things like that throughout the year. You would have, it depends on the service you're going to get, the service, you would have a percentage of that bill. Nothing would be, you will be getting bills. Small bills, it depends how much your bill is and what kind of service you're getting. You're going for outpatient. You're getting something.
Is going against the 3,500.
Yes, but the thing is you don't know what you're going to be getting. And that's why people like to go the other option because they know there's no surprises with Medicare. And they're all different. Coverage is different. That's why I always say you have to read between the lines. Nothing is free. Nothing is free. And it's not bad. I mean, I have clients that don't mind going within networks and getting referrals, and they come and say, hey, my parents live to be 95. I don't mind. I don't even have a doctor. So they're not bad. It's just some people want the flexibility. Understanding your health care, with your original Medicare, it includes Part A and B. Pay deductibles and co-insurance, the 20% if you don't have a Medigap. Your Part B monthly premium, that $202.90. Part A is usually free with 10 years of work history. You can see any doctor nationwide. If you're on trips, if you're in Hawaii, Italy, Europe, you don't have to worry about it. No referrals needed to see specialists. And then you can purchase that Medigap. Remember, during your initial enrollment period, when you're new to Medicare, you are guaranteed a Medigap policy without being underwritten. If you decide to hold off on that, and you're just going to stay with Medicare, and you decide to go the following year to get a supplement because you got diagnosed with cancer, most likely you're not going to get a supplemental plan. The Medicare Advantage must cover all Part A and B services. You're going to have your co-pays, your co-insurance, and deductibles. You have to have your Part B premium. You have to pay that. Usually requires network of doctors and hospitals. You may require PCP and referrals, so you may have to get referrals, especially if you have that HMO, Medicare Advantage. And then you have your annual out-of-pocket maximum, which each plan varies. That $3,500 was pretty minimal. I've enrolled people into $6,000 once. And some of them do have an additional monthly premium on top of it. The biggest difference is flexibility versus structure. Original Medicare gives you nationwide access, while Medicare Advantage plans often use networks, but include an annual spending limit as well. So there's a lot more restrictions with them.
Here's co-insurance.
Co-insurance is what you would pay. So like Medicare is 80%, you'd be responsible for the 20%. Yeah. Any questions? Yes.
What would be, on percentage-wise, G and N? Well, I'm saying on premiums.
It depends on your age. Remember, every year it does go up. Getting a lot of calls because Blue Cross really went up this year. So remember that. Just because we enroll you in a plan when you turn 65, remember it's going to go up. Your Social Security income goes up, you're gonna have to pay the Blue Cross Blue Shield or whoever you choose. I would say about $20 difference.
Oh, that's it.
That's it.
Between the G and N?
Which is really nothing. Yes.
It's gonna be poorly worded. What if one decides to go back to work after having been in Medicare and the employer does offer insurance? What do I look out for? How?
Cost, what it's gonna cover. You have to do what's gonna be the cheapest route for you at that point, and what it's gonna cover.
But is there a rule that I have to go back to commercial insurance if I'm working full-time?
You could definitely drop Medicare, as long as you can, yes, as long as you're going with a company that's offered credible coverage.
And then if I want to go back into Medicare, am I subject to underwriting if I pay?
No, because you would have a special enrollment period.
Okay, thank you.
The key thing point there is that you have to make sure it's credible coverage. So anything that is a small company with less than 20 employees, most likely it's not gonna be credible coverage.
The home health care services are covered by Medicare.
Medicare does cover home health care, like a visiting nurse, a bathing aid. It depends on what your doctor offers and what he thinks you need.
So you need referral for that
You definitely need a doctor's referral.
from PCP.
Absolutely. Everything it's an order from your physician. You need to go home with physical therapy, occupational therapy, a weekly nurse. That's all under home health care.
There are some websites offer home health care. Are they separate from?
Those are separate.
Huh?
Those are separate.
Yeah.
Those are separate. Yes.
If the original Medicare and fitness is included, how do you get to go to like the valleys or?
Original Medicare does not cover fitness. However, a couple years ago, there are some insurance companies, like Blue Cross Blue Shield is one, and AARP, United Healthcare, that is offering comprehensive plans.
How do you get that covered?
So Plan G, Blue Cross has a comprehensive plan. So it's covering additional benefits, but with just a higher premium on it. So I enrolled someone a couple weeks ago, Plan G comprehensive, and it included silver sneakers, dental, and vision. But it's a higher premium, and not all insurance companies offering that yet. Right now, it's United Healthcare, AARP, and Blue Cross Blue Shield. So that's becoming very popular because people are really liking that extra benefit, especially with dental. Medicare does not cover dental. So that's another thing you want to factor in.
Let's say if you didn't take medical and you had a cataract, you would go to a optometrist, you go to
As long as you see an ophthalmologist, Medicare will cover cataract surgery. They will cover that. You have to actually see a specialist. It does not cover lenses or frames. You're fully responsible for that. Yes? Nope. Good question. You just have your deductibles. Yes?
I'm with Blue Cross, I'm in N plan.
Okay.
How many times a year can they raise the premium?
Once a year. Once a year they raise it.
And is that, it's not on January 1st, is it?
It's usually in April.
Okay, so that's,
Usually in April.
okay, thank you.
Yep. Every year it's raised. Yep.
So no matter what supplement you have, it's always most likely gonna go up
Every year, based on age.
Like how much approximately?
Depends. Can't answer that. Depends. My parents are 76 and they pay $690 a month for 2 Medicare policies, Plan G. It's expensive. That doesn't include the Part C, the Part B premiums, or their co-pays. It's not easy. It's not cheap to retire. That's why people are working beyond 65. I know. I think Ann said they are recording this.
Yes.
Yes, so yeah.
Are you, I'm sorry, I take it back.
I am Enza.
Okay, so you're not a broker.
I am not a broker. No, no. I'm just here to give you the facts and try to make this as simple as possible. You know, when you are deciding on, I don't know what to do. Should I go with a Medicare Advantage? It's so much cheaper. You know, you have to, and don't listen to your friends. You need to look at yourself, your genetics, your overall health. You know, you have to, it's not about what your friend does. And half the time, they're not even telling you half the story. I promise.
You see the commercial flips, oh, you get a health club, free.
Yeah, nothing is free though. You got to remember that.
But the most important thing is catastrophic. That's why you buy insurance. It's not.
It's yes, absolutely. You're right.
Nobody can do your bathroom in a day.
Right. Nothing. Nobody.
I'm a plumber and I'm in construction.
You know.
Impossible.
It's, yeah, nothing, I always, like, but people get, you know, excuse me, they get sucked into it. You know, you're watching TV at night. I mean, those commercials are overwhelming, especially during that Medicare open enrollment phase, right? That October 15th, it's the flyers people get.
White and blue on the top, and you think, oh, this is from Medicare, and you call them, you gotta look at the fine.
Yeah.
These are all broken.
It is, and a lot of our older adult clients, you know, they are the ones that get trapped. Because as soon as they hear free, they're like, oh, sign me up. Like that lady called me, $1,500, it's free grocery card. I'm like, no, something isn't right here. So, you know, and a lot of our seniors, you know, they're on fixed incomes. You know, they worked really hard, and not that we all don't, but it's a different generation. So, yes. Yes, so that does vary. It does vary based on your formulary, and that means the medications that you're taking. Okay, so like say you're taking like lisinopril and a atorvastatin, a statin, right, for your cholesterol. I know that, right? Those are generic. So most likely, we're gonna get you on WellCare or Humana with a 0 monthly premium because those are like the lowest, very inexpensive medications. Now, once you start going into insulin, you're diabetic, you're taking inhalers, you're not most likely going to have that 0 monthly premium as far as your Part D plan. You're going to have to pay something for that premium. I've seen plans up to $102, but with no deductible. So they're paying a higher monthly premium, but less co-pays at the pharmacy. But what's really nice now is Medicare, it's actually passed this year, is that $2,100 cap. I have clients that cannot afford those high cost co-pays at a pharmacy. So what Medicare decided was, well, we can have you pay directly to your Part D plan and pay that $1,200 over a course of a year. So instead of paying those co-pays at the pharmacy, let's divide that $2,100 because that's your cap. You should be paying more than that over that 12-month period. So you're paying that Part D plan. And it's easier to budget for some people that way. To me, it's about time they did that because when I have clients that can't afford to pay that high deductible in January, that's pretty expensive for a lot of people. They like that they have that option now. Let me divide this over, that 12-month.
Enza, if somebody takes a really expensive drug, what's that new thing that Trump passed?
Like no. Like Xarelto.
Yeah.
Like I know a lot of people take Eliquis.
50%.
Eliquis, I think, is one. I think there's some like the GLP ones, like the weight loss drugs.
Penicillin being there?
Which one?
Penicillin?
I don't think so.
Penicillin,
Not
but, if you're diabetic.
insulin. Insulin is so insulin that came back. That came from that was a couple years ago where there's a $35 cap on insulin. So you shouldn't be paying no longer than $35. But what is expensive today are those Eliquis and the Xarelto, the blood thinners. So that's made a big difference. But you're still looking at about, I think, $70 to $80 a month.
And if you use a coupon at the pharmacy to get your costs down for like the Eliquis
Yep.
and Xareltos, that doesn't count towards your deductible.
No, and that's not for Medicare beneficiaries. That's only for commercial insurance, employer insurance. So they offer it to people that are working, but not offer it to people on Medicare that would really probably appreciate those coupons, right? Because you're on your fixed income.
If you were on Medicare, like say you go to Jewel, you have that plan where you get a coupon, so many stamps or whatever, but they say if you're on Medicare, you don't get.
You don't qualify.
But what if you don't have prescription drugs
Like,
as part of your Medicare?
well, you would get penalized for not having a drug plan,
Yeah.
but as long as you have Medicare Part A and B,
Yeah.
that you're a Medicare beneficiary.
My dad has F.
The Cadillac plan.
So,
Yeah.
And they say, well, no, you can't get the stamps.
No.
That's because you're on Medicare.
You're on Medicare.
But he doesn't have prescription.
It doesn't matter. You are a Medicare beneficiary as long as you sign up for Medicare A and B. You don't have to have a Part D plan.
Yeah.
You know, I have clients that are very, like, no, I don't want it. Why am I going to pay for a Part D plan when I don't take any meds? But as long as you have Medicare A and B, you don't qualify for those coupons. Yes.
I'm just kind of confused. For the supplemental, the Medigap, it says the policies are standardized and the benefits in each lettered plan are the same no matter which insurance company sells it. So
They cannot change, so those are standardized the federal government, the Centers for Medicare creates those standardized plans.
so that each insurance company sells it at different.
At different price, yes, different premiums.
You just go with the cheapest one? It says-
Absolutely, go with the cheapest one.
Okay.
The thing is, like this gentleman said, you can't go back and forth because you're gonna get,
The
yeah.
only thing about the cheapest one is who has good customer service.
Oh, definitely.
That's
You
very important.
absolutely.
So you might pick the cheapest one, but the customer service might.
Right, right.
But the coverage is all the same.
The coverage is the same.
Yes, but, you know, customer service can be very critical.
Yeah.
Question about a coverage on a claim and they are arguing with you. Customer service is very important in my opinion.
It is. I mean, you want, even when you go to a restaurant, you want good service, right?
Been on a drug, doesn't matter.
Especially Part D. Part D could be really difficult, prescription drug plans. That's why I strongly advise to definitely review your drug plans. Yes? What? Well, that's with the Medicare Advantage plan. So you definitely want to make sure you have good customer service with the Medicare Advantage plan. I mean, you do, right? Because like this lady said, if there's a claim and you want to make sure you're able to get through, right? And you can actually talk to someone live. Yeah, there's no networks. You can go basically anywhere you want with a Medigap policy. Yeah, those are, yeah. Yes?
Trump RX, I think it's just, you can't order, but the one that I use is plus Mark Cuban.
Okay,
It's cheaper than.
okay, yeah, educate me. Tell me about it. This is like, it's brand new.
I paid $5 for shipping.
Okay,
But my doctor
that's good to know.
sent it over, and it's very, at least with Medicare.
Yeah, that's good. Yeah, look up Trump RX. Yeah, I mean, I know it's new. I really haven't done that much research on it, but
Good RX or whatever it is.
The GoodRx isn't so good.
But I think the Trump RX, like you're stating, is for those higher cost medications.
Yeah, there's Trump RX, there's GoodRx, and there's Cost Plus.
Savings. So it's for like the Xarelto, the semaglutides, the weight loss. If you go to that website, you're gonna get the additional cost savings discount. I think that's what it's for those high cost medications. It's in the big beautiful bill.
Trump is just, shows you a limited subset, I think it's on the.
Ozempic, you got your Wegovy, what else do people take in? Manjaro, yeah. But he did, I mean, a lot of people are on those drugs now, so there has been a huge decrease in costs for that, so, which is great. Yes?
Do you have any insights on standalone dental plans?
Do I like them? Not really, because I feel they don't cover much. They're usually very costly. If you have a good relationship with your dentist, I would probably recommend paying for your services. They're about $40 to $50 a month, and they basically only cover preventative. So like as far as teeth cleaning, things like that, but as far as like crowns and, it's very similar to employer insurance, right? I mean, you go to see your dentist, and even with your employer insurance, you're paying, what, $600-700? So when people come to me like, why am I paying $50? They don't want to cover anything. You know, it really depends on your dentist. So I always recommend, if people want dental insurance, go to your dentist and ask them what is the best insurance that you take.
Because they'll usually ramp up dental, hearing, and eyes together.
Well, and that's where that plan, the comprehensive plans, like the Plan G plus the additional benefits, may benefit you if you want those extra for an extra $20 a month compared to $50 a month, paying for the standalone dental plan. So something to think about.
Was the silver sneakers, was that free only for the
The Medicare Advantage, yes, but with those comprehensive plans that like Blue Cross offers, like the Plan G plus additional benefits, it's like an extra $20 a month. But it covers the dental, your vision, and silver sneakers. So some people are like, I'd rather just do that, pay the extra $20, instead of having to get a standalone dental plan, which they're gonna charge you at least $40 to $50 a month. And you're still gonna have all those co-pays and stuff like that. It's just like regular employer insurance. You're usually capped. So it's something to think about. But thanks for the Trump RX. I'm gonna have to look into that because I keep forgetting about that. Trump RX, yeah. I don't know, but you know, it's new and I'm gonna look into it. Yeah.
Just like we should all be getting anywhere between 6,000 down in your, off your taxes this year. If you're 65, gotta be between the fine line.
I don't know. You really gotta read, yeah.
Yeah, whatever. 171,000.
Okay. Well, that would be nice for a lot of people.
Yeah, and if you go beyond that for a couple, then it starts shaving it a little.
Yeah, of course. The more money you make, the lower, yeah. Yeah, anything helps, especially nowadays. Any other questions? You guys are a great group. Great questions, honestly. Thank you so much for coming out tonight. I really appreciate it. Thank you. Thank you.